Hi there, I'm the neuromuscular mechanic, and today we're going to be talking about first carpometacarpal joint injections or first CMC joint injections. So what do I use them for? I use them for joint arthritis. So that will typically be primary osteoarthritis of the first CMC joint, which isn't uncommon. Whenever I do injections, I have a checklist. This checklist is what I go through before I start the injection. So I need to have the right patient position, use the right transducer, have a quick way to localize the structures through the surface of the skin, identify important structures on pre-scan to avoid, and then identify my target. So if we go through this with patient positioning, I will have the patient supine or sitting with their arm by their side so it's easy to access the joint. The forearm will be in neutral with ulnar deviation at the wrist. That will also open up the joint space, make it easier to access. And then I will inject from proximal to distal. Depending on whether I'm injecting on the right or left side of the patient, I will either be between the joint and the patient or distal to the joint because I'm always trying to use my dominant right hand. The transducer I use is a linear high-frequency probe to get the best resolution of superficial structures. For surface localization, you can take your ultrasound probe and put it in long axis to the first metacarpal. And then if you move that probe from distal to proximal, you will then identify the joint space. And so this is the technique I use, and this will be the technique that I will show on the ultrasound videos in a few moments. Besides surface localization, I need to be able to identify in structures to avoid. In this case, it's the radial artery as part of my pre-scan. And then with the target, once I've identified the joint with the technique I've described, I'm going to bring the needle in from proximal to distal. But what I often do is I put that target joint near the medial and lateral aspect of the probe, so not on the central part of the screen, so that I can have a steeper needle entry to get into the joint, which I feel is important to avoid structures such as the radial artery and given the relative size of the ultrasound footprint compared to the joint. So here I've started with the video, and I have the ultrasound in long axis over the first metacarpal bone that we see there highlighted in red. And what I'm going to do shortly is I'm going to move the probe along the long axis of the bone from distal to proximal until I see the joint space. So here we go. So as I move it, there we go. And then if I freeze there, there's my first CMC joint with the metacarpal bone on the far right of the screen and then the trapezium on the far left. Now this, if you were injecting in plane, which is my preferred technique, would be hard to do. And so what I'm going to do now is I'm just going to move the probe a little bit medially laterally until I identify this cliff of Dover view, where the cliff is sort of that drop off from the first metacarpal or MC here on the image, and then we see the trapezium there, and the joint space is what I've identified here with the white arrow, which is how I would approach the joint injection. Now, in a second here, I'm going to move the probe a little bit more medially and laterally, just to show again this cliff of Dover view. But I also want to point out to you that the hypoechoic joint capsule. So here is that hypoechoic joint capsule, and so I don't necessarily have to bring that needle directly into the space between the two bones. I just need to bring it into the joint capsule. So that concludes the videos. I'm the neuromuscular mechanic, and I hope you found today's video handy. Take care.